beautiful people, hello, welcome back to my channel. If you're new here, my name is SHIRU. I trained back in Kenya as a nurse and I apparently work in the UK as a nurse. So in today's video, I'm going to discuss the OSCE exam, which is done by the nurses who come to work here in the UK after they have completed their CBT exam back in their countries. I'm also going to share the top 10 tips to pass your exam with one go. So if you like this video, please give it a thumbs up, and if you've not subscribed to my channel, kindly consider subscribing to my channel, and I really appreciate you for that. Let's get into it. What does OSCE exam test you for, or what does it mean? So OSCE, when I had that abbreviation, for me it was very hard, it was very tricky, and I was wondering what it was. OSCE is an exam that has been designed to test you for your nursing skills. It's like a practical exam. After you've done your CBT, that is what you come to do, is practical after doing your theory, which is CBT exam. OSCE means an objective, structured clinical examinations. And this OSCE, it tests you for assessment, planning, implementation, and evaluation. Also in this exam, you're going to be given two skills, which are two scenarios, and you're going to carry out the two skills. So in assessment, what you expected is to do vital observation for a patient who is a real life actor. It won't be a real patient, but it will be a real life person or a real life patient who will be an actor acting as a patient. And you're supposed to do the vital observations, and you record in the news, or you record the observation in the GCS, depending with the kind of scenario that you've been given, or the kind of history that you've been given, or what you expected to do in such a situation. Planning, you're supposed to write a care plan for your patient. Implementation, you're supposed to give medication, which is usually oral medication. And evaluation, you're supposed to write a discharge letter for your patient. In the evaluation stage, or in the evaluation part of the OSCE exam, you'll be given all the paperwork, that is from the assessment, planning, implementation, and you're going to write a discharge letter for this patient that you've been managing. Then after the assessment, planning, implementation, and evaluation, you're going to be given two skills to do. The skills, you may be given peak flow, you may be given ANTT, which is aseptic non-touch technique for wound dressing, or you may be given subcut or IM injection, or maybe you may be told to do a urine sample collection, which you're supposed to do it from a catheter, or you're supposed to do BLS, which is basic life support, depending with the scenario that you've been given. So I'm going to share the tips to passing your OSCE exam, and I've said they are the top 10 tips to passing your exam. You should follow these tips and they might help you. My number one tip is to identify the kind of exam you've been given. This is by what's the rationale, what are you expected to do. That is my number one top most tip. So once you've known what you expected to do, it will be easy for you to know what to carry out and how to approach the situation or the scenario that you've been given. Number two, identify yourself. Good morning, my name is Lilian, I'm your nurse and I'm going to give you your 9 o'clock medication. So you identify yourself. As you identify yourself, you are supposed to create a rapport. This brings me to the second tip. Second tip is gain the consent. Once you've identified yourself to the patient, good morning, my name is Lilian, I'm your nurse today and I'm here to give you your morning medication. So you're going to get the consent. Are you happy if I go ahead with giving the medication? And then the patient will tell you yes or no. But in most situations, of course, it will be yes. Once you've identified yourself, you've gained now the consent, you are supposed to identify the name of the patient. Not just identifying the name of the patient, but the correct name of the patient. So identify the correct name of the patient. You have the documents which have the name of this patient you're dealing with, and they have a wristband which has their name as well. Before you touch the patient, you're supposed to wash your hands. And this should be in every skill that you're doing, you should wash your hands. Every skill that you're doing, you should wash your hands. Before you think of touching the patient, wash your hands using the 7 steps of hand hygiene. So these 5 tips you will be expected to carry out in all parts of the OSCE exam. So you'll be expected to do the first 5 tips you must carry out. Now let's go to tip number 6. Complete your documentation on time. So assessment, you're supposed to complete within 20 minutes. Planning, you're supposed to complete within 17 minutes. Implementation, you should complete within 16 minutes, and evaluation should be completed within 14 minutes. Guys, you should not worry, because in the exam room there's a clock there which is showing you the exact time it will be, and it's gonna alarm in case you run out of time, or when you finish, or when time elapses, it's gonna alarm. It's gonna alert you. Tip number 7 is to make sure that you've completed documentation. What you should not miss in your documentation is the correct name of yourself, of course, and the correct name of your patient, time, date. So correct name of the patient, date, and time. They should not miss in your documentation. So when, as you say, you've completed your documentation, you must make sure that you have those ones. And something else, you should make sure that like in the implementation where you're giving oral medication, make sure you go through the medication sheet and make sure that you've signed all the drugs that you've given. Make sure, go through it even if it's twice, thrice. Make sure that you've completed and you have names. And also something else you should not forget is to identify the allergy for your patient whom you are giving medication. That is in implementation. And then when you come to evaluation, remember I did mention that you'll be given all the documentation that you've had before. That is from assessment, where you have your MUSE or GCS, depending with whether you had been asked to do GCS or you are doing the normal vitals, which you're gonna record in the MUSE record. So you will have all, and you will have your care plans. Now for this, like care plans, guys, before you go to do your exam, go to your manager or go to your colleagues whom you are working under as a pre-registered nurse, and they should help you with the care plans that they have been writing for their patient or for their resident in case you're working in a care home. They will really help you to practice for your care plans. And evaluation, I said you expected to do a discharge letter. So this, I'm still on the point, and I'm still on the tip of documentation. make sure that you have the correct name of the patient, and you have date and you have time. And in the evaluation, you should include the care that has been done for your patient, medication that have been given and those which have not been given. If there are any referrals, remember not to forget to include them in the discharge letter while you're doing your evaluation. My tip number 7 is to make sure you're communicating, you're telling the examiner what you're doing. You may do your skill very correct or in the right way, but if at all you're not talking to your examiner, you're gonna fail that exam. And this point is where you see the examiner might try to ask you a few questions on what you're doing. It's just because they want to be a part of what you are doing. They want to be a part of your exam. They want you to tell them what you're really doing. So remember, guys, to communicate. Communication is very crucial when it comes to OSCE. A good example, let's say you are doing a skill ANTT where you're supposed to do wound dressing, and probably you've contaminated the area which is supposed to be sterile. Stop, tell the examiner what you've done. You've identified and you've acknowledged that you're wrong, and you tell them that you're going to restart the procedure again, and in that case now you're going to do it in the correct way and make sure you don't contaminate the sterile field. I don't know whether it's still the same as the way we used to do, because I remember you would ask the examiner, you would say, this is what I've done wrong, are you okay if I could continue? And they would say yes or no, but of course they used to say yes because you've already acknowledged what you've done wrong and you are ready to move on, but you've already acknowledged, so they'll tell you where to continue from. My tip number 8, do not panic. Do not panic. I know this is an exam. It's okay to be nervous, but just imagine, because you've been having a training with your trainers, imagine it's your trainer or your mentor who is just observing what you're doing and that you're doing it in the correct way. Put yourself in that situation where you've been, because before you get there, you've already done an OSCE exam mock, which usually follows the procedure for the real OSCE exam. So make sure you don't panic, and if you panic or if you feel nervous, it's okay to be nervous. Calm down, take a minute, breathe in and breathe out, and then tell yourself, now I'm in an exam, but the person who is here is an examiner. Assume or just imagine is that trainer, your mentor who was training you for the OSCE exam, who is there with you, and you'll be able to calm your nerves and you'll be able to continue with your exam. So that is my tip number 8. Do not panic. Take a deep breath and imagine that the examiner is the same mentor who was training you for your OSCE exam, and they're just observing that you're doing the OSCE exam in the correct way. My tip number 9 is practice, practice, practice. I do emphasize you continue practicing. Practice with those with other nurses whom you are training with for the OSCE exam. So you'll be given like a study leave depending on where you're working. You'll be given a study leave, and this time you should maximize, use it properly. Practice with your colleagues. If you're not practicing with your colleagues and you're in your house, make sure to do it by yourself. I can use this pillow and just assume that this pillow is my patient, and I'll use it and I'll communicate. You communicate to the pillow as your patient and record yourself so that you can go through your recording and see what you've done correct or what you've done wrong. See where you're missing out, and that way you'll be able to evaluate yourself whether you are ready for the exam or not. That is the part of practice. My tip number 10, guys, is be presentable. This might sound funny, but it's not funny. Be presentable. Being presentable is that you are smart, you know, your clothes are ironed or your uniform is ironed. You are not worried when you're in the exam room. Did the examiner see this? Are they seeing this? Are you trying to cover up something? You know, just be smart, be presentable. For me, being presentable, even in normal way or in normal situation, whether there's exam or not, being smart, being presentable boosts your confidence. So if you're presentable, it's gonna boost your confidence. So guys, those are my top 10 tips to passing your exam. Now, something I may mention is that your OSCE exam fee, it's £794. This money is going to be paid by your employer, and you're going to pay them back depending on your agreement. Like on monthly basis, they're gonna deduct that money from your salary. And in case you've failed the OSCE exam and you need to receipt, you're going to pay £397 for the receipt exam. And in most cases, I think you're gonna pay for yourself this time. It's not the employer to pay for you. So yeah, kindly find out how. Guys, I apologize in advance in case you've not been able to hear me very well. I'm not able to project my voice because I've not been well, but I hope I was audible enough and you're able to hear me. So in case you hear my voice is not great, guys, I do apologize for that. I wish I could do something, but I've not been well. But I'm so happy to bring to you this video. I didn't want my voice to hold me back, and I didn't want to hold further without bringing to you this video. So I would say thank you so much for watching, and in case you've not subscribed to my channel, kindly hit the subscription button, and also remember to give this video a like, and I'll really appreciate you for that. So without much to say, I'll be seeing you in my next video. Mwah.